Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Health is a state of physical, mental, and social well-being, not just about the absence of disease. And we at the Doc Talk Show are committed to making sure that you are healthy and thriving. This segment of the Doc Talk Show is wonderful because we are going to meet a very incredible and wonderful medical clinical officer who is in the community making sure that people have health and they are thriving in their community. Thank you for tuning in this evening. And before we meet our wonderful guest, I encourage you to invite your friends, your neighbors to tune in on the Doc Talk Show so that we can learn together and thrive together. Welcome, Mr. Andrew Wefwafwa, to the Doc Talk Show.
Thank you very much, Dr. Catherine. I'm so pleased to be here. Wefwafwa Andrew, as the doctor has said, I'm a clinical officer. A clinical officer, they do diploma in clinical medicine and community health. And I'm so much passionate about that component
of community health. Yes.
Though I do medicine, I practice medicine, but I'm so passionate about that aspect of community health because it looks at the whole community.
Thank you so much.
Most people call me a community specialist.
Thank you so much, Andrew, for allowing to appear on the Doc Talk Show. And Uganda has one of the highest populations. We are now more than 45 million people. However, our doctor-to-patient ratio is so low, yeah? We have about 0.2 to 1,000. That is the doctor-to-patient ratio. Very low as compared to the World Health Organization standard of 1 to 1,000. Way lower than countries like Cuba, which are over 8 per 1,000, and the USA, which are about 5, yeah? So when we have people who are passionate about community health, people who are doing things in their community, in a place where we are constrained by the number of physicians per patient, we are so thrilled and excited. But most importantly, I am very excited about the work that you are doing on making sure that people are healthy and thriving. So Dr. Andrew, kindly tell us what you actually do. What are the approaches that you're implementing in the community to make sure that people are healthy?
Yeah, thank you very much, Doctor. To our viewers out there, as the doctor said, health is not just a mere absence of disease, but it involves many things. How someone is doing physically, mentally, and socially. And my goal is to see that all people are healthy, not just a single individual, but the whole community.
Yes.
So my approach is helping a lot of people because I'm looking at the community as one person. So all the plan that I'm trying to design is to make the community better. Just like in medical, we have a lot of things that we do. When a patient comes, you take history, and then you end up with a diagnosis, you do investigations, and you treat. So I'm doing the same, but now looking at the community.
Yes.
Yeah. So my approach is helping people because of that approach that I use.
Yes.
Not just looking at the physical aspect like like we usually do in the hospital, but I'm looking at those aspects as we mentioned. So first, because of the teaching that I do, people have come to learn about their lives. I was surprised. Actually, I was not surprised, but I reached in the community and the things that we think that they are obvious, like malaria. they are actually not obvious.
Sickle cell,
Sickle cell,
hypertension.
They are not obvious. Many people don't know those things. So when I reached in the community, the people were paying a lot of attention and people were enjoying a lot.
Yes.
The mysteries, as if the things were looking like mysteries, yet it is just basic knowledge.
So one of the things that you actually do when you're in the community is to train and give knowledge that addresses some of the things that we are seeing in community, and we are thinking it is witchcraft or some bad omen, things like that.
So that is what I do. My goal is to make sure that people are having knowledge about their health, such that they can be in position to make smart decisions about their life. Because I want someone to know when I feel headache, what is happening, what may be causing headache. So I try to give people the basic knowledge, and as I talk in my community, people have started knowing these things because they are not hard. And I make sure that I don't teach them in English. I teach them in the language that they understand. So I go and break down all the things that happen and how those signs and symptoms come about. And what is happening in a body if you're having headache in the local language. And you really see people enjoy, and people have started learning about their life. So that is what is happening at the moment, and it is one of the benefits.
Thank you so much, Andrew, for that approach, for sharing your approach. And I understand that when you train people and give them education, you empower them. They are able to actually seek health care when they need to earlier. And when they seek health care earlier, it means that they are going to save on money, but also they are going to they will not die from illness because the disease or the illness is not going to become severe, and they don't even have to be referred and you know, they end up in catastrophic health expenditure, so they save more money, communities start to thrive. And that is why I am so thrilled about the work that you're doing, because when we do a lot of prevention and treatment of many of these diseases at the grassroots, you know, everybody gets to benefit. Currently, where I work, we are overwhelmed by number of OPD patients, and one of the reasons to why my father, who is a chronic disease patient, doesn't like coming to hospital is because the queue is so long. They know I'm going to go to hospital, and I find a very long queue. So when you do something that prevents people to actually from coming to seek care, you're doing such an incredible job. So we applaud you and we celebrate you this evening.
Thank you.
Yes.
Actually, I've seen that, and it is working, because in most cases, like you said, patients go to the hospital. But in this approach, the doctor or a medical worker is going to see the patient at home.
In the community,
in their home. So there is a way people in the community feel comfortable, because I go there when I'm dressed like I'm supposed to be at work in the hospital. I'm in a gown and everything. So they end up getting used to that. And when you go to them, they feel so special, and they get to open up and they give you the information that you could not be able to get from the hospital. Actually, most people believe that health workers are tough. But when you go there and you be with them, they even get encouraged to come and visit you at the hospital if you call them.
Thank you so much, Andrew.
Really
wow, that is really amazing. I'm excited that, you know, actually people get to approach you, and then they can actually give you the right history, so you're able to make the right diagnosis, and when you give them treatment, they are even they will follow the treatment regimen better. Thank you so much for that. We are going to take a short break and we will be back.
You are watching the Doc Talk Show.